Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is April 19th, 2025. This video is on a JAMA review on cataracts published on April 14, 2025. Cataracts clear the fog. Cataracts are a leading cause of blindness worldwide. They happen when the natural lens of the eye becomes cloudy, making vision blurry, full of glare, halos, and poor night vision. Over 2/3 of the adults above the age of 80 are affected. 15 million global cases of blindness from cataracts. The good news: cataract surgery is safe, quick, and life-changing, reversing visual loss and improving independence. Risk factors and diagnosis. What causes cataracts? Aging is the big one, but also blame diabetes, steroids, UV light, and genetics. They're diagnosed with a slit lamp exam after dilating your pupils. You may see just fine in bright rooms, but struggle with glare, halos, or night driving. That's a clue. The American Association of Ophthalmologists recommends exams above the age of 40 years and every 1 to 2 years above the age of 65. Surgery and safety. Think surgery sounds scary? Cataract surgery is one of the safest procedures out there. Performed under eye drop anesthesia, it takes about 15 minutes and uses ultrasound to remove cloudy lens and replacing it with a clear implant. The bonus: fewer falls by 30% and maybe even lower dementia risk. The optional premium: the intraocular lens will reduce the need for glasses. No need to stop anticoagulants or aspirin for the procedure. Complications and takeaways. Complications are rare but real. Macular edema, capsule tears, or infection prevented by intraocular antibiotics. Most complications are manageable. Tell your surgeon if you're taking tamsulosin. It can make surgery tricky due to floppy iris syndrome. The bottom line: cataracts are treatable. Don't wait in the fog. See your way to clarity today. 98% satisfaction with cataract surgery. Podcast brought to you by Master MedFacts at mastermedfacts.com.